After the break, the beauty segment is up.
Do not miss that one. Welcome back to Studio One, and it's time once again to focus on the body beautiful. Tonight we're talking about liposuction and one of the most popular non-surgical alternatives.
Here to tell us more is Dr. Jaffer Khan, specialist plastic and reconstructive surgeon at Aesthetics International. Welcome, Dr. Khan. Your reputation procedure. I've read quite a bit about you. Now I have to ask, all of us women, at one point or another, fantasize about having that perfect body, some nipping and tucking. What kind of procedures do you offer for body sculpting?
Well, traditionally, as plastic surgeons, particularly in a community and an aesthetic setting, we would offer liposuction or liposculpture. We'd also do a series of different body contouring procedures involving removal of skin. And these can be, for example, you've heard of the bat arms or the bat wings, tummy tucks. These are the common ones, body lifts and buttock lifts. So these are the things that we could do by skin excision.
Shopping list.
But it goes a little bit further than that. I mean, really, the muscular structure of the body is very important. And so we encourage patients to understand that the definition of your muscles and the fact that you go to the gym, work out, is a very important part of body contouring, as is the skeleton.
Now, doctor, there are way too many terms over here, and I'm a little confused. So if you can break it down to me, there's body sculpting, there's contouring, there's liposuction. Can you just break down the difference between all of these?
Well, it's an interesting question because the nomenclature is confusing sometimes. But the basic way that we contour today is by changing the subcutaneous fat structure and the external skin structure. So when you're talking about body contouring, as a general, it encompasses everything. Liposuction addresses the fat. Body lifts, skin excision procedures, they talk about essentially how we can address the envelope. And those are the two most common ways. And liposculpture is a kind of more superficial liposuction where you have to be very careful and use very much thinner cannulas and multiple passes to try and achieve the shape of the more superficial tissues.
Now, doctor, say if a patient doesn't want to undergo surgery, what is the other alternative that you would suggest them? Well,
this is an often asked question, and I think there was a time when I was using something called lipodissolve, which is phosphatidylcholine, and this has been actually medically shown to dissolve the superficial fat layers, and you do this with injections. It's a little tedious, and the results are not always consistent. Then I'm sure you've heard of, this basically the roller technique, which is endermology, which was the first generation, and then subsequently radiofrequency treatments came in. Then Syneron came out with this machine, Velashape, which looks like a big vacuum cleaner.
A vacuum cleaner. We thought this was brought to clean the studio.
but indeed, it's one of its modalities is, much like the endermology technology, it sucks up the tissue first, encourages the lymphatic drainage. Then second technology is radiofrequency, which has been medically shown to add heat to the tissues, increase the fat metabolism, and indeed fat breakdown. And the third modality is infrared, which is a kind of more superficial heating. So with these three combined modalities, we have Velashape, which I think works really well for cellulite. And cellulite is really difficult to treat even surgically. So therefore, I think for ladies, and again, I wouldn't suggest this machine for somebody who's looking at massive weight loss or serious contouring.
Well, on that note, we want to talk about liposuction over here. Is it actually a good option for weight loss? I've heard so many things about it. I've definitely seen some dramatic and amazing results. I want to hear it from you.
Yes, there have been in the past people who have been actually aspirating close to 17 liters in one sitting. Wow. I think we have to understand that there's a lot of hemodynamic changes. If somebody is going to undergo that kind of procedure, they go straight to the intensive care unit. This is not something that you do casually. You have a team involved, and it's not something I like to do. It's not something I suggest to my patients. You know, bariatric surgery has superseded that now, where you have the gastric sleeve and the gastric bands, and patients lose weight on their own. Unfortunately, subsequently, they're left with a lot of excess skin. And then this is addressed by the skin excision procedures I was talking about earlier.
Well, doctor, we have one of our Facebook viewers who have tried to reach us because she has a question for you about this treatment. We have Darlene on the line. Hello, Darlene.
Hello.
Hi, Darlene. What is your question for Dr. Jaffer?
Okay, I just turned 18 and slightly overweight, and I have a tummy. Will you advise me to go through surgery or should I go first for Bella?
Okay, thank you, Darylyn.
Thank you.
You're welcome.
I would need to ask her how much overweight and whether she's had any children yet. Or
Well,
She's
18 years old.
so.
sorry.
Let's hope not.
Well, I think if you're moderately overweight, say about 5 to 7 kilos, most of us struggle with that, and if the predominance of fat is around the midsection, showing a hereditary predisposition, then I would say why not try the less, less aggressive, so to speak, techniques first.
And is this a less painful option as compared to liposuction? Like you said, if it's just a little bit of weight that you want to shed?
Well, it's not painful at all.
At
This
all?
is like having a massage. Sometimes there's a little bit of bruising because the blood vessels get traumatized. But I use this machine even after liposuction, 4 weeks down the line, to get rid of the additional edema fluid.
Now, there's a bit of a myth that I keep hearing. I don't know if this is true or not. Maybe you could clarify. Liposuction, if you get liposuction done on your arms or a part of your body, specific part of your body, and then you gain weight again, what happens? Does the fat ever get distributed to that area, or is it redistributed everywhere else?
Yeah, that's a really good question, Dina, because we get asked this a lot. I think all of these procedures, I think it's important to remember it's about lifestyle. You have to choose a lifestyle, you have to stick to a particular diet and a routine, of course, veering every now and then. But if you increase your caloric intake after liposuction in a particular area, you're bound to put it on somewhere else because your predisposed fat depot or your preferred fat depot has now been removed because the cells have actually physically been taken away. So then it has to go to the next depot, wherever that might be. So I think it is important that after liposuction, which is a definitive procedure, by the way, that you have to maintain your balance.
All right, thank you so much, Dr. Khan. It's been great talking to you.
Thank you, thank you.
Thank you so
All
much.
right, earlier we announced our Groupon competition where you could win 4 pairs of tailor-made shorts, anti-aging treatments, perfume, and a de-stress package.
All you had to do was answer this simple question. What bird is Chef Scott Price cooking on the show this evening? Is it A, a hummingbird? Is it B, a pigeon? Or is it C, a ladybird?
The answer is, fortunately or unfortunately, pigeon. And the name of the winner will be appearing on our Facebook page this very evening, so check it out to find out if it is you.
Right, we are running short of time, and so we need to head back to the kitchen to find out how Chef Scott's pigeon is doing because he just has 60 seconds left.
Okay, so we've got the hazelnut puree going onto the plate, and then what I'm going to do is just spread that around. I'll show you how to do this in the restaurant. In the pan, I've took the pigeon out, it's already roasted off. A little bit of the crispy legs on there. I'm going to carve the pigeon. So you see it's nice and rare.
Ooh.
Okay.
Okay.
Hopefully that's okay for you.
Nice
So-
and red there.
Yeah.
Got a red in there.
Nice bit of pink, it's fine.
What pink?
Okay.
Sorry.
A little bit on there. Yeah, pink. Okay. And then we've got crispy hazelnuts around the outside like that. Spoon on a few
Pomegranates. Under
pomegranate
30
seeds.
seconds,
Okay.
Chef.
Nice colour. And we've got some nice spicy watercress, peppery watercress that we're going to put on there.
We've got our colors going on here in the dish.
Very,
Under
very bright
15.
dish. Okay. And then this is the hazelnut dressing that I've made as well. So just around the outside and over the top like that. So you've got roasted pigeon, hazelnut salad, and pomegranate. Okay.
And your time
You don't
is
even look
up.
worried,
I'll
Ash.
take a
You're
little
trying
piece off
something
this.
for the first time.
Okay.
Well, you know, I like to try new things, so I'm going to go for this one.
It's really light. It's really light. No, I like it.
It's like chicken, but only a little more tender, I would say. It's quite nice. Well, Chef, thank you so much for that. That is a cracker. Recipe to that on our Facebook page, facebook.com/Studio One Live.
Now that's all we have time for this evening. Thanks to all of our viewers and guests who have joined us throughout the show. And of course, to all of you for watching.
Don't forget to join us tomorrow, same time, as we meet a 5-time Olympian champion and find out what your kids need to eat at school.
Goodbye.